Dr Derek here. So I live in a lovely part of the UK known as Manchester. Now, for those of you that don't know the UK very well, although it's a brilliant place to live, Manchester has some of the worst weather in this country. Honestly, it's so bad. This is a far cry from the hot and sunny tropical climates that I grew up in when I was living in Ghana, and also where I just came back from holiday. I'm just about to make my way to work for a 10-hour shift. It's 6 a.m. It's pretty dark at the moment. It's going to be dark on my way to work, and when I get home, it's also going to be dark as well. So I will lie coming back to this dark, wet and rainy environment after some time back home in the sunshine was really difficult. I noticed that my mood was affected, and then I realized that what I was going through is something that more than 2 million people in the UK suffer from each year. This is a condition known as seasonal affective disorder, short for S.A.D. This is a low mood disorder that occurs at a specific time of the year, typically during the winter months. During this time, there is less natural sunlight. So there are a few common signs and symptoms of this condition. So as discussed, people can have a low mood, but also you might have difficulty concentrating and also with sleeping. Some people find that they're withdrawing from social interactions with friends or families. You might find that you are losing interest in stuff that you usually and typically find real joy in. And sometimes it can all manifest in physical symptoms, such as headaches, body aches, and digestive issues. So if you suspect that you have seasonal affective disorder, it's really important to consult with your healthcare professional so that you're assessed, especially if your symptoms are particularly severe. Some treatment options include light therapy or phototherapy. Now, this involves exposure to a bright light which mimics natural sunlight. This can be particularly effective for seasonal affective disorder. Light boxes are designed to provide the right intensity of light. A healthcare professional can give you further advice about the next steps and what you can do if you're considering this as an option. It's important to look after yourself. Try and spend some more time outdoors. Have your curtains open. Try and get in as much natural sunlight as you can during your day. Engaging in physical activity has been shown to improve your mood because, as we know, physical activity increases the release of endorphins, our feel-good hormones. Like with a lot of stuff, diet is so important. So make sure that you have a really well-balanced diet, rich in fruits, vegetables, whole grains, and your lean proteins. Now, vitamin D, we often refer to it as the sunshine hormone, and especially in the UK during these darker months, a lot of people have a low vitamin D. So it's important that you supplement yourself with over-the-counter vitamin D supplements because this could boost your energy levels and overall have that improvement to your mood. Other things that you can do to help include limiting your exposure to alcohol and caffeine, because these two things will have a significant impact on the quality of your sleep and also therefore affect you feeling more tired throughout the day, which will invariably have an impact on your mood. Now, remember that not one person behaves and responds the same to another. So if you're still really struggling, it's important that you're seen by a healthcare professional. And one thing that I want to leave you with is that remember, spring is not too far away, so we can get through this, guys. If you want to know a little bit more about what you can do to help yourself, I know I mentioned vitamin D. I've created a very detailed video which will give you everything that you need to know about vitamin D and how it can improve your energy levels. So make sure that you check it out. As always, if you found anything I've said today helpful, please leave a like and subscribe. Make sure that you share this with your friends and family. And remember, I truly care about your health and I wish you the very best.